CPT 99212 explained. It is the established patient office visit that runs 10 to 19 minutes, and the visit length you document decides which code you can bill. Submit a time tier that does not match the visit, and the claim comes back for correction. CPT 99212, an office or outpatient visit for an established patient, 10 to 19 minutes. Here is how it fits MassHealth addiction treatment billing. We cover what 99212 is, where it sits in the established patient ladder, and which MassHealth manual the accepted codes come from. CPT 99212 is an office or outpatient visit for an established patient, lasting 10 to 19 minutes. It is one of the established patient evaluation and management codes MassHealth lists among the most commonly used for Massachusetts addiction treatment Medicaid claims. Established patient office visits are a separate family from the new patient codes, which run from 99202 through 99205. The established patient codes are separated by visit length, so a documented time that does not match the code you submit invites a denial and a rework cycle. If the note supports a different time tier than the code billed, the claim is exposed to correction, delay, or denial. Every claim sent back is staff time your billing team spends recoding and resubmitting instead of working the next admission. A generic EHR treats 99212 as just another code. MassHealth is built for behavioral health, so it is designed to keep the established patient EM ladder straight at the point of billing. Purpose-built coding support is designed to help your team match the visit to the right established patient tier before the claim goes out. Surfacing a code to documentation mismatch up front is how programs cut the rework that generic systems let through. To bill 99212 with confidence, see where it sits on the established patient ladder. Let us walk through 3 rungs. 3 reference points, all straight from the MassHealth code list. First, the rung just below 99212. 99211 is an office or outpatient visit for an established patient lasting less than 10 minutes, the shortest rung on the ladder. Second, 99212 in the middle. 99212 covers an established patient office or outpatient visit of 10 to 19 minutes. Third, the longer rungs above it. 99213 runs 20 to 29 minutes, 99214 30 to 39, and 99215 40 to 54. Longer established patient visits step up the ladder. Keep the 2 office visit families separate because the codes do not overlap. The established patient office visits run 99211 through 99215, separated by visit length. New patient office visits are a separate set, 99202 through 99205. Never bill a new patient code for an established patient. These codes are not guesses. MassHealth publishes the full accepted set. The full range of CPT codes MassHealth accepts for addiction treatment billing lives in Subchapter 6 of the MassHealth Substance Use Disorder Treatment Manual. MassHealth accepts a wide set of codes and modifiers, including modifiers for special populations like young people and pregnant or postpartum patients. MassHealth administers Medicaid in Massachusetts, while the Bureau of Substance Addiction sets the standards providers follow. MassHealth connects clinical documentation to billing, so the established patient code on the claim reflects the visit your team actually delivered. The platform is designed to help match an established patient visit to the right EM tier, from 99211 through 99215. Billing, insurance authorizations, and a complete revenue cycle workflow are designed to support clean MassHealth claims from one place. Clinical, admissions, treatment plans, and billing live together, so the visit you document and the code you bill stay aligned. Stop reworking mismatched established patient claims. Book a 20-minute demo at behavehealth.com. See Coding Support and Revenue Cycle Management built for behavioral health billing at behavehealth.com.